Hello, all. We are going to discuss your feet today. Today's subject is on your feet, a look into foot care for improved health and performance. And just before we get started, I thought it'd be a good idea to just recap very, very briefly the anatomy of the foot. There's many bones, joints, muscles, tendons, ligaments. There's actually a whole bunch of nerve down there too. That's why it hurts so bad when you stub your toe. Our feet tend to become insensitive because we put them into shoes at the beginning of the day and we leave them there till the end of the day. But in theory, if you were to spend a lot of time barefoot, your feet would actually become more and more sensitive, and you could possibly use them better or maybe function with them a little bit more. I've never tried to write with my toes, but there are people who can write with their toes. So those feet are complex, and we're going to dive into it a little bit more today. Sprinting and lifting. I've got quite a few word-heavy slides on today's presentation. This is I'm going to try and make this the only one that I read through. And I don't know that I'll read through all of it, but forefoot running with a forefoot strike is a running technique where the balls of your feet just behind your toes with the first part of the foot to strike the ground. Running with a forefoot strike is described as running on your toes and certainly feels very light, springy, fast. However, it also places a lot of strain on the calf muscles and Achilles tendons. So I'm going to stop right there. Think about that forefoot running on the balls of your toes. That's going to cause extra stress on the Achilles and the calves. We're going to dive into some of those tweaks and injuries today. Depending on how aggressive you forefoot strike, your heel may not come into contact with the ground at all during stance phase of running gait. This type of ankle stiffness is great for sprinters, but it can also be a recipe for Achilles tendon injuries in distance runners. Yeah, when people run different. We're gonna recap on that a little bit more shortly. Lifting, talking about rooting or creating a solid foundation between the foot and the floor. Many lifters never really think about it as an important connection. When doing lifts like this, the squat or deadlift, we drive force on the floor to make the weights upward. The feet must be rooted correctly to transfer maximum power through the body to the bar. I'm gonna stop reading on that one because we're gonna talk a little bit more on that. But a couple of good links there for you, where I just pulled those bullets from. And yeah, our feet are so ignored. They're so underrated. They're so underappreciated. When we use them, most of us use them all day long. Especially in sport and in training, and we just don't give them the foot care or the time and attention that they deserve. All right, so a little bit more on that running. All right, so if we're running and we're heel striking, that might mean that we are being a little bit less efficient than we could be. So this individual over here has that heel strike out front. And if you think about all the force that's going to be coming back into the body, because if we think about physics, every action has an opposite and equal reaction. So as our foot clomps down in the ground in front of us, the ground drives force back into us. And if it's your job and your goal to go forward as fast as possible and as efficiently as possible, that big overreaching step forward may not be doing you any favors. Now, if you're exhausted or if you've got the big, fluffy, comfy shoes on, maybe it's not so bad. Maybe it's kind of what you need to do. But if you're in sprinting, remember, you're overexposing that hamstring a little bit there. You're overextending it and putting it under a lot of force. So watch your foot strike. And just like we've kind of talked about in the past, with that foot strike, you're probably going to want it a little bit closer to underneath your center of gravity. And then going on from there, the midfoot strike. So again, if you're running a little bit longer distance, that forefoot strike over here may not be in the cards if you're doing a longer race or just a long session out on the roads for just cardio purposes. but trying to avoid just repetitively driving your heel into the ground. I think there might be some benefits to a more conservative foot strike, such as the midfoot strike. And then when you're going for your higher speeds, the forefoot strike is going to be beneficial for many reasons. You've got the stretch reflex, you have minimized ground contact time, you have just that plyometric effect, and just more efficient running technique. Because remember, after that foot plants, it's going to want to come back up, and you're going to dorsiflex again in your drive phase there. And again, as you're trying to go fast, if you stay in your acceleration phase, especially for shorter distances, there will be benefit there is that you're staying in the proper posture, you're staying in the proper positioning. And if you want to hear a little bit more about this and running technique, you may want to read this book. It's a good one. And in it, they'll actually talk quite a bit about minimalistic running, and they'll talk a little bit more about shoes and technique a little bit, and sort of how we are in theory designed to run. I also could have put the pose method in. This would be another good one for researching theories of running technique and running posture. And learning a little bit more about this, when we're running on that forefoot, all the stress that's going through, let's get back in here for a little bit. All the stress that's going through the bottom of that foot, through the plantar fascia, and then up through that heel into your Achilles. It's just it's not a recipe for disaster, but it's an opportunity for issues, I guess I would say. The more you're training and the higher intensity that you're training at, you're probably just giving yourself some wear and tear, and things happen. So we're going to talk a little bit about how to prevent some of those issues, and also how to maybe combat them a little bit once they've maybe started up. Okay, how about that foot positioning during squatting? So I considered talking about the rotation of your feet during a squat pattern. And I will just make a very short blanketed comment that chances are you're going to want your toes slightly externally rotated, or your feet slightly externally rotated, to help access and activate your glutes a little bit more. But I'm gonna leave it at that. So I didn't really want to make that the discussion about that. But I'd be happy to run through that and talk a little bit more about that if anybody's interested. What I really wanted to talk about was that foot positioning. And seeing over here on pronation, think about that flat, maybe that arch collapsing and coming inward a little bit more than we want it to. So in this diagram, it's kind of hard to tell on here, but that's the inside of the foot. And that's the outside, I guess, medial and lateral. So neutral, so you've got a little bit more of that arch there. You're maintaining your structure a little bit. And then supination would be, I guess, maybe a bigger arch and a little bit more weight on that outside of that foot. And in your squat pattern, you're going to want to probably be somewhere over here. This is going to cause probably some problems as that ankle collapses inward. That knee is probably going to be soon to follow. And as that knee comes in, you're losing access and utilization of your glutes, and you're getting in poor biomechanical positioning. So you're losing out on muscle activation, as well as just getting into inefficient postures. So when we're squatting, it becomes more dangerous, because if you're setting that groove and setting that movement pattern, and then you're an athlete and you go out on the field and you're competing, or court or whatever, and you're competing, if that knee has if that ankle has a habit of collapsing and pronating, and the knee has a habit of going valgus and sagging inward, there's a great chance that something bad is going to happen to your knee. ACL might be 3 letters that kind of ring a bell. If that knee is going valgus on a regular basis, and that there's just shearing force inside that knee, and it's not ideal. So when you're squatting, consider working on that arching position there. Some weight to the outside of the foot will have benefit. Again, not wanting to make this the biggest squat lecture, but what are your feet going to be doing? They're probably going to be slightly externally rotated to pre-activate and help us connect to our glutes. And also there's some femoral head benefits in a lot of people's pelvis. But as those feet are already externally rotated, what you're actually going to do during a squat, some hard squats, a little bit on the heavier side, to give you some extra benefit of activation, getting your muscles firing and just your nervous system integrating from giving every benefit that it can. You're going to be driving into the ground and actually trying to rotate the ground extra and trying to separate the ground. That's going to help you drive more muscle fibers into the game, more muscles. So you're already rotated to start. You get the load out, you're squatting, you're flexing into the position, and as you're extending, you're thinking about rotating your feet further outward. You think about separating your feet, and you're also going to be compressing your toes and flexing your arches downward. And that's a weird one. That one is kind of hard to explain. But I found a picture that I like quite a bit. So instead of showing you guys my feet doing it, I thought we could just take a look at this next slide here. I like this one quite a bit. All right, so this is maybe more of a relaxed foot. If you take a look at the toes there, just kind of hanging out, whereas these toes over here, they are gripping the floor for dear life. You can even kind of see on the arch there, just a little bit more activated there. Okay, so think about the Colosseum. All right, so all those arches have kind of stood the test of time because it's an optimal way to disperse force. Okay, so a greater arch there, and just like we were talking about in the previous slide, that greater arch is going to yield benefits for your ankle position, your knee position, and the muscles that you're able to activate. Also, I've mentioned it before, but the more muscles you're using, the stronger you are. So even if they're dinky little foot and toe muscles, the more muscles you're using, the stronger you are. And this may just be in my mind, but this foot is a little bit darker or tanner than this foot. So it might just be the lighting. It might have nothing to do with this, but I also kind of like the idea that when we're flexing this foot, more blood is going to be down there. So we're going to be activating it. We're going to cause more blood flow. We're going to cause a greater arch, so greater biomechanical position. And when you're using, the more muscles you use, the stronger you are. So when squatting, experiment with that a little bit. It's not so much like I don't know if you've got long gross toes like me, you can kind of get your toenails down a little bit extra. But it's not really what you're trying to do. You're just compressing those toes into the floor and squeezing that arch underneath. And if you don't know how to do that, Sometimes people don't have the mind muscle connection and they don't have that coordination. Kind of like when a little kid goes to flex their bicep and they're just bending their elbow. They're not activating any muscle tissue. Additionally, they just know that a bent elbow is like a bicep. Whereas later in life, they start to practice it and then they can start to activate that muscle. If you cannot activate those muscles down there, I would challenge you to start working on that, to start trying to build that connection. All right, so now we're going to shift a little bit into some injury care, injury prevention. All right, the Achilles tendon, which runs just behind your ankle, from your heel up into your calf muscles. Couple little, pardon me, a couple little factors on that. Rupture chances for the general population increase in age 30 to 40. 5 times more likely in men. Women's gymnastics has the highest rate of all Achilles injuries in NCAA sports. So think about that 4 foot running that we were talking about earlier. These girls, when they're sort of combining some of that 4 foot running with the sprinting, and then there's also high trauma landings where they're taking a lot of force and they're in rotation, things like that. So they're getting different batches of stressors than most individuals. And just with all that running, they're just those Achilles are kind of at risk. There's even some antibiotics and steroids that cause issues. And then again, think about physics with obesity. Every action has an equal and opposite reaction. So an obese individual just under more weight, every pound more that you weigh is another pound in all your tissues downward. But because of physics, every action has an equal and opposite reaction. As your body compresses into the ground and pushes off, every pound that you have going downward is also going to come back upward. And if you happen to be traveling at a fast rate, the forces go up even greater than that. What are some intervention strategies? We'll do a little bit of a lab section up next, but for now, let's just say we both want to stretch and strengthen calf muscles. So we want that sweet spot where we are flexible and mobile, but also strong. Give yourself a variety of exercises. Beware of your running surfaces and progress training slowly. So I've noticed that since I'm so far removed from being a typical athlete, predominantly a soccer player in my youth, when I return to a track or a soccer field, if I haven't run for quite a while, one of the biggest mistakes I make is that in my head, I think that I'm about half the age that I am. And I start running around and trying to run a hard mile or just open up and sprint downfield as best I can. And that causes tweaks and little injuries and issues. Whereas if I go back and I take several sessions to build up, then I'm able to run aggressively. So one of the biggest mistakes I personally have made, and I'm on a pretty good hot streak for staying healthy right now, because I've sort of learned my lesson, is that I'm just taking my time and doing progressive sessions. So if you have a deconditioned athlete, an older athlete, just take your time with them and give them the opportunity to immerse themselves in these activities. All right, so let's go do some lab work. Let's go do some physical activities here. let's take care of our Achilles a little bit. First, I want to bring up a 70-30 stretch. This is actually one I made up for my divers because I was having divers who when they enter the water, their ability to dorsiflex and really point their toes helps minimize the disturbance to the water and like that extra splash. So they earn extra points and they get higher scores if they're able to extend their ankles a little bit extra. So in thinking about that, I came up with this 70-30 stretch. And in the 70-30 stretch, what I'll do is I will give myself a position there to maybe grow that range of motion a little bit. But really, for most athletes and most of the time, what I'm really going to focus on is the posterior side of my calves, ankles, lower legs, whatever you want to call it. So, called the 70-30 stretch. I'll put about 30% of my weight here and about 70% of my weight on this leg over here. And what I'll do is I'll kind of give you guys two angles on that. 70-30 stretch. Remember, on that Achilles, we just want to grow our range of motion there a little bit, get a little bit of stretch going. So that's the 70-30 stretch. I'm a fan of Dr. Kelly Starrett, who's a physical therapist. And he advises minimum of 2 minutes for static stretching when you want to create a change in resting tissue length. So if you're just doing it for like a little bit of recovery or whatever, I don't know, you can just hold it as you like. But if you are really concerned about the length of that tissue and you want it to get a little bit longer, I would turn to Dr. Starrett, Kelly Starrett, and say minimum of 2 minutes. Just look at my cheat sheet here. Okay, slant board or just like an edge. So you can also just take an easy route there and just have something to just stand up and work off of. A lot of weight rooms will have slant boards, and you can just do both calves at the same time. I could have brought over another dumbbell. In fact, I can even double down right there. And I'm getting a nice stretch to the calves. After I film this video, I might come back and do some more of that because that was actually feeling pretty fantastic. And then just a split stance if you don't have any equipment. Just right there, just create that angle. It's a calf stretch, people. I mean, we can think of so many of them. You can drop down and pump out reps there, or do holds, or whatever you like. One thing that you may not be doing historically as much of would be scraping. So a simple little tool like that, that's Amazon, that was under $15. You can, I imagine pretty much any lotion would work, but there's a product that I use a little bit and like it. And so you take some of your, let's get a better angle there. You take some of your lotion or scraping gel or whatever they might call it, and you just apply it down to that Achilles surface, and you would just end up scraping there a little bit. So I don't want to make this video about scraping, but scraping tool, honestly, probably most, like think about like a butter knife handle. So not the blade of a butter knife, but the handle. You could probably take that butter knife and just turn it around. While you're doing the butter knife, you could probably, probably lotion, with any lotion do the trick. But just getting on there and just doing a recovery modality on that Achilles, probably not a bad idea. And then for myofascial release, this is another one that I'm I've stolen from Kelly Starrett is he says, or he has you tack down the tissue and then flex that ankle, take it through the range of motion. You know what, I just recalled, I think I was saying dorsiflex earlier in the video. And this is dorsiflexion. Lifting your toe up is dorsiflexion. Plantar flexion is downward. So I think I might have bobbled that a little bit earlier. So forgive me if I did. But anyways, tacking down that tissue. So instead of stretching it from the articulations, you're just giving yourself an opportunity to stretch that tissue in a different way. So think about taking a rubber band from the ends, it's going to get thinner. But if you take that rubber band and squish it between your fingers, it's going to get thinner as well. So there's a stretching mechanism in there. So a little extra pressure, you can kind of do almost like a little bit of a massage and articulation at the same time. And then if you're looking to strengthen those tendons and the tissues around it, think about just a variety of calf raises. So you can even just sit on a bucket here and do calf raises. For some extra weight, you can stack some plates on top of your knees and do some calf raises there. Standing calf raises obviously work. Doing walks in plantar flexion. You can do some walks in we can't even see me anymore. So doing some walks in plantar flexion, doing some walks in dorsiflexion will help strengthen up the tissues. Obviously, the toe walk is going to work the Achilles and the calves a little bit more, whereas that's going to hit the toes up is going to be anterior tips a little bit more. But it's always a good idea to strengthen your antagonistic muscles as well. And then just a really easy way to approach that would be some sled drags, where your feet are just forced to work a little bit slower and grip the ground a little bit more. And probably a pretty good one would just be heavy squats. If you want to challenge those tissues, a heavy squat can be a great way to just challenge the base of your foundation and including all your supporting tissues down here. So there's some quick ideas for Achilles. And now we'll pop back into our lecture and talk about plantar fasciitis. Moving on from the Achilles issues, we are now talking about plantar fasciitis. And again, not looking to read everything to all of you. I encourage you to maybe pause it and take a minute to read it through, or the slides are available as well. With plantar fasciitis, we are usually concerned with the tissue that lays underneath the foot. It's sort of structural and builds up that arch. It kind of comes down from that Achilles we were just talking about. And so the thigh bone's connected to the knee bone, as they used to say back in preschool. But yeah, all these systems are interrelated and interact regularly. So that tissue down there is the plantar fascia. That plantar fasciitis is common in ages of 40 to 60. Certain types of exercise, such as long distance running, ballet dancing, foot mechanics, whether you have flat feet and that arch has collapsed a little bit, or a high arch can affect that plantar fascia and irritate it. And again, obesity can cause an issue, kind of like we were talking about with the Achilles, is just that constant additional force, maybe giving your tissues a little bit more of a challenge than they are designed for. And then occupationally, hey, just those individuals who are foot bound, standing up more hours per day, you're just challenging the tissues extra and giving them some issues. How about some intervention strategies? So doing physical therapy, and they talk about stretching the plantar fascia. I'll address that again shortly. However, I would say think about if you've ever tweaked a hamstring or strained a hamstring. How much do you really want to stretch that hamstring? Like a great big stretch may not feel so good, and it may sort of set you back because that tissue's in a highly irritated state and may not want to be aggravated by being pulled apart additionally. So I would just say let's sort of beware of a whole bunch of stretching on that plantar fascia during times of stress. Night splints. So they have these, think about like an ankle brace that will actually hold your ankle in dorsiflexion. So that's toes up towards our shins. As I maybe have misspoke once or twice on this video already. But it's going to hold your plantar fascia and Achilles tendon in a lengthened position overnight. So I've never worn one of these, but it's almost like an ankle brace. And then you just have a little doohickey strap that comes from your front side of your top of your foot back to your ankle, and you tighten up to just pull that ankle into dorsiflexion. That's toenails towards your shin. We've got orthotics and specialized boots to kind of support those arches and try to hold our foot in maybe more of a neutral position to help things heal and to maybe just improve our movement overall. And if you've got the right training and tools, there's some different therapies you can do there. As far as surgery goes, I guess that's an option as well. I don't have any comment on that one way or another. Of the few people I know who have had plantar fascia issues, bad enough for surgery, also fell into, I'll jump back to our previous slide here. Of the few people I know who had plantar fascia surgery, they also had they're in that age window, they were obese, they had poor foot mechanics, they were not doing very much exercise. So no, not commenting on surgery really one way or another, but perhaps if those individuals could have made themselves younger, or if they could have combated their obesity or done more exercise specifically for that, maybe some of those things might have helped prevent surgery. Not much of an opinion on that. Not really my area. Okay, with the plantar fasciitis, let's go do some more lab work. Let's go be active here. All right, so we're talking about that plantar fascia. Oh, there we go. We're talking about that plantar fascia, right? So more scraping, so returning to that scraping. I'm a fan of the modality, and I think for these little baby muscles on the bottom of our feet, it can be extra beneficial. And on our feet, we actually have, the way the tissues run, they actually, you have some cross tissue there, and ends up creating kind of a triangle there. So if and when you're scraping, you can almost make like a little circle. You can almost make a circle one way and then bring it back around and just end up massaging that. So, or you can, I mean, it doesn't have to be with a tool, that butter knife or whatever. You can just go hands on and massage that foot, or you can go both sides at the same time to work that plantar fascia tissue, right? So remember that Achilles tendon is running down here, and as it transfers over through here, it spreads and it turns into that plantar fascia tissue that's almost like banded, right? It's kind of fans out a little bit. So you're gonna have pain more so with the plantar fascia on those longer sides, but in the center arch too there, because remember that tissue fans out. If you look a couple of slides back, you'll see that where that tissue separates out and kind of like flows like a river a little bit. For myofascial release, so that's what scraping is, but if you want to look at other modalities, that lacrosse ball, okay, 2 of the best dollars you can probably spend in your life are on a lacrosse ball, and just getting in there, front, back, side to side, little circles, little star patterns, whatever you want to draw, however you want to do it. Probably not a bad way to approach that. You can also just take something simple like a marker. So again, Kelly Starrett, there's one of his books. That's a good one. It's Becoming Civil Lovers, all about self-care, basically, like how to take care of your own body. And he uses markers sometimes on his hands, but you could probably use that on the feet as well. So he'll do examples of working your digits there with a marker. And he might even have you scraping your own foot with a marker as well. I don't recall. But and then when we're stretching that, again, think about having a hamstring issue. If you had a big hamstring strain, you probably would not be too interested in pulling that hamstring and doing big stretching on it. You probably want to stretch the things around it and just help that hamstring feel better. With that plantar fascia, from a little bit of personal experience and from what I gathered through research, it's kind of the same thing. We don't really want to stretch that out when it's irritated too much. We don't really want to aggravate it or record it extra. What we might have better benefits doing is doing all the stretching on the Achilles and the calves as we did for the Achilles issues. And then there's quite a bit of like a common piece of advice that I hear for the plantar fascia issues would be to be pulling at the toes. So maybe skipping the area that's super irritated. So how I was doing the elevated toes for a stretch earlier for my Achilles. I'd maybe do that if I was wearing shoes, but I probably wouldn't do that with shoes off. That might irritate the tissue a little bit. And all of the scraping and maybe the lacrosse ball that I'm using, I would just be gentle there. I don't want to irritate. I want to facilitate healing, but I don't want to irritate that tissue. Let me check my cheat sheet here. All right, so how are we going to strengthen our arches? How are we going to strengthen our arches? So think about that squat pattern that we were working on earlier with that image. So think about just gripping the ground. So take a moment now, maybe get some reps in of gripping. So Remember how I told you I've got long gross toes and I can curl them under? That's not what we want to do. We want to compress and flex our arches, right? So there's a difference between that curling motion, and that arch flexion. And when you're squatting, what they talk about spreading your toes and then, so I'm gonna spread my toes and then compress. There's a difference between that and balling my toes up like I'm really cold or something. I don't know. Or maybe I'm trying to squeeze into some small ice skates. Played ice hockey for the first time last night in my life, by the way. Speaking of ice skates. So that's something for your arches. Another idea that is actually, it's pretty simple. Let's see, I don't know, I haven't used this towel before on it. So, oh yeah, that works really nice. You're just doing toe curls. I'm gonna give myself a little assistance. I was getting a little stuck there. All right, that works. Maybe the edges here. So my heels aren't moving, but I'm collecting more and more of that towel. A bigger fluffy towel, I would get a better grip on. But this one's actually a great challenge. And I encourage you to really be doing this at home, whether you're using a towel or a t-shirt or whatever, because that just really goes right into that foot. I'm pumping blood in there. I'm getting a little bit of like a muscular burn. And yeah, that's exactly what I want to do with like another muscular injury, is I would want to be doing like a light activation and getting some blood flow in there. All right, so that's some arch work. As far as isometrics go on the arches, you could do those squat squeezes. Maybe we'll call them squat squeezes, where we saw the picture earlier. But also for isometrics, and consider just returning to our plantar flexion and just a hold there. You can do it with your hand on something for balance help, or not. You could just do like a freestanding hold here, and kind of funny, after like a whopping 15 or 20 seconds, I'm actually getting worse at it. Probably due to maybe just a little bit of muscular fatigue in there. But yeah, that's pretty interesting. And just a hold there. And again, maybe it's because my arch is already activated from that towel gripping motion. But as I was standing there, I could feel that arch firing up a little bit. So some isometrics there. Again, when tissues are damaged, taking them through big full range of motion may cause some irritation, which is to hold like that is better than normal. And also, remember with our 3 contractions, concentric, isometric, and eccentric, the concentric is the weakest one. So if I do something eccentrically, like a hold, or I'm sorry, isometrically, like a hold, my strength is actually a little bit greater than normal, because concentric is our weakest contraction. Okay, we did toe curls already, and then toe yoga. So I've seen several different toe yoga demonstrations, and probably the simplest one would be like an attempt to articulate each. Okay. Oof, those pinkies don't want to lift up. So I can't really lift my pinkies up. How about my ring toes? And then big toes. Oh, I'm all about those big toes. I can do whatever with those big toes. And then my nervous system is just linked, so I can't do those individually. And I really can't do my pinky toes at all. But you can try. And then toe yoga. So you can do that. You can open them. You can arch them. And you can just kind of play around with them a little bit. And again, just like we talked about earlier with the stretching, you can also go in there, and Kelly Starrett, and I believe it's in his book Supple Leopard, he talks about the benefits of going in and opening up those toes. So don't make it weird. Don't make me play with my foot by myself. I hope you guys are barefoot and messing around with those toes at home as well. Another book you may want to check out is The Brain That Changes Itself. The Brain That Changes Itself, which is all about like healing capacity and neuroplasticity in the brain. And they actually, if I remember correctly, they take an ape's fingers and they sew two of them together. So, maybe I can't do that with my toes, but with my fingers and hands, no problem. I should be able to do that with my toes, but I've just been wearing too many shoes for too long, and I've lost my skill set. Anyways, in The Brain That Changes Itself, they talk about an experiment that was done, and they sew a couple of fingers together. I don't know which fingers, I can't remember. Let's say it's like those two fingers over there. They sew those fingers together, and originally the ape could articulate both joints. They sew the fingers together, and the neural pattern goes from two different branches to one. And then they at a later point, they separate those fingers again. And for a while, the ape is still on that same neural branch. But then at some point, the neural pathway separates again. So, and that's all happening within the body. So right now, my toes, like if you saw my pinky toe, I couldn't get any action on that thing. And then my middle three, I couldn't really do too much different. They're pretty much all on the same one. And then you saw my big nasty toe. I was able to do all kinds of stuff with that thing. So when you think about toe yoga and just articulating there, you're getting a lot of movement down there. You're increasing blood flow. You're increasing the dexterity in your toes, which when you're on your feet running around and doing athletic motions, does it make sense that might yield some benefits? I think so. So take your shoes off, take your socks off, play around with your feet, experiment. Let's see who has the good articulation on their toes. I'll keep working on mine and to get a little bit better at it. All right, let's go talk about flat feet. Okay, hold on a second. Before we go to talk about our flat feet, I borrowed some bullets at the bottom of the slide there from a podiatrist center that I found online. And again, think about how that plantar fascia is irritated tissue. So staying off your feet as much as possible for a couple of weeks, letting that tissue calm down and start to heal. They talk about icing it with a 10-10-10 pattern, which is 10 minutes on, 10 minutes off, and 10 minutes back on again. Some pain relievers. Again, they talk about stretching your plantar fascia, but I don't feel like they mean to max capacity. I think they mean lightly to encourage and facilitate additional blood flow, and maybe just to prevent it from tightening up and scarring over in a shortened position. They say don't walk barefoot because they want those muscles to relax, and so they want some extra shoe and arch, some extra arch support, I believe. Supportive shoes when you walk, and they say just get a cheap arch support for your shoes. So maybe not necessarily. I've gotten orthotics before for my feet, and it was $100+ to go get it, and they say just go get a little something. You're just looking for a little bit of help. So we'll talk a little bit more about shoes later on. All right, flat feet. Let's see here. Again, I don't want to just read through everything. I know I'm guilty of that a lot of times. Just think about that arch collapsing and going downward. It can give you a lot of problems for reasons we already talked about. You're taking all those muscles in the plantar fascia that we were just talking about, and you're stretching them out. You are encouraging, think about what we were talking about with the squat pattern and your biomechanics. As that foot flattens out, that pronation is so much easier to go into, where your ankle collapses inward and subsequently your knee, your glutes turn off, and you're not squatting with the proper movements, and you have more knee and possibly ankle injuries. So just some issues that might come from having flat feet. Obesity, again, obesity is not helping anybody out in the foot department. Extra injuries might come with it. And then I can't really, I guess from what they're saying, that rheumatoid arthritis can make it worse. Aging might make it worse. Maybe that aging aspect is just challenging your feet for 5 or 6 decades and never taking care of them. So maybe that's what the aging thing is about. Maybe it's some loss in strength, like that sarcopenia that happens as we age. So maybe it's the loss of strength in the muscles down there. And then diabetes. I imagine that there's just the diabetes might be a result of like tissue degradation in the foot. So sometimes in really bad diabetes cases, there's amputations that take place because circulation is impaired in some of the feet. So those last few things I'm speculating on. If anybody wants to correct me, please do so, but please do it in my direction so that I can learn a little bit more. So intervention strategies. All right, arch supports, stretching exercises. Again, this is for flat feet. Supportive shoes, physical therapy. Physical therapy, flat feet may contribute to overuse injuries in some runners. A physical therapist can do a video analysis of see how do you run to help you improve your form and technique. And then I just threw in a little image there just so we can kind of better understand that arch collapsing and disappearing and just get one more little view of it. Okay, so for stretching, well, think about the fact, before we go do this lab portion, think about the fact that you have tissues that are already elongated, all right? So you'd want to be wary of stretching them further. However, if your calves are a little bit longer and looser, it may put less stress on the plantar fascia and it may allow them to shorten up. So I'd probably just kind of leave it that I would stretch around it, but not directly stretch on it too much. Not a podiatrist, not a foot certified specialist. I'm sure somebody out there is like a foot specialist, but that's not me. From the research I have done and athletes I have spoken to regarding flat feet, stretching the arches does not seem beneficial. So you're going to get probably a little bit less stretching with this one and more about strengthening and activation. Let's go knock out a few of these exercises real quick, and then we'll come back and kind of wrap up. We've got a few more things to talk about. I believe this is our last lab portion, so let's knock it out. Okay, so in that previous slide, I included a link, and that link will help us see these 3 videos again and possibly better. But these are the 3 videos that they suggested as for helping out these fallen arches. And that first motion, we've got 3 motions for us. And that first motion, so our anterior tib is out front here, but there's a posterior tib, okay, hidden kind of on the back wall here. And what we're going to do here is we're going to come up and articulate into extension with some like an external emphasis. So I'm actually going to come up and I go out on my pinky toes And I'm coming back down slow and easy, back down to neutral. So you can't quite tell, but my center of pressure and mass is just shifting out just a little bit from center on my feet. So I'm getting pretty base of my pinky toe heavy on my way up. So I'll do one more there. And I control back down. And I'm gonna go for a single here. And yeah, you can't see too much, but that was kind of tough. I'm probably where I'm at. I'm probably, whether it's my body weight or my weakness in my limbs, I'm probably, if I'm gonna do quality reps and really control it, I'm probably gonna go bilateral for a little while. Double check my sheet. Okay. So I've got another one for us. I'm gonna drop you guys down. You can watch me from a different angle here. All right, so let's see how I do. Let's see how I do with this. Threw an extra line on my foot there. It already kind of looks like, I don't know, like a rainbow that forgot all the other colors. It's just a blue line that's kind of got like a little baby arch to it. And what I'm doing with my arm is I'm just going to brace against the wall. And I'm going to push into that wall a little bit. But I'm going to try and create some tension and some torque from my foot. Oh, and if you saw, I started curling my toes again because I've got these like long, nasty toes. But what I think I really want to do is just compress long toes down on the ground. Because when I start curling like that, it creates like a false arch. It's kind of coming from a little bit different space. So I've got my bent elbow against the wall. And I know you guys can't see it, but I am working just as hard as I can there. And I'm getting just a little, I get just a little bit of payoff in that arching, in that little blue line there. Kind of like that mustache that people like draw on their finger and then put underneath their nose. But as I am, I mean, when I get that little baby rotation there and I'm pushing into that wall, I'm blown away at how much activation I get in that foot. That's going to be something I return back to on a regular basis when working with myself or helping athletes out. And then the third one is easy peasy. It's a banded clamshell. So again, I've been talking all day about the connection from your feet to your glutes and those biomechanics and muscles. And we're just gonna knock out some banded clamshells there. External rotation. It's part of what my glutes do, right? So your glutes AB duct, they extend and they externally rotate. All right, we've got some more slides to go through. Take your time, really experiment with these three motions, all right? So we had the calf raise where we rotate over onto the base of the pinky toe, and then we bring the pressure back to center as we lower. We had that bent arm pushing the wall during rotation. I want to make sure you guys kind of get that one. So I guess you probably get it. Now you can't see my foot, but I'm just pushing into that floor as best I can. I mean, there's no risk of me putting a scratch in that wall. I'm barely using it. But I just feel this awesome connection from my foot up into that arm. So If you didn't do that, if you're just like, if this is running in the background, stop what you're doing and go try that one. And then we did the banded clamshells as well. Okay. Not much to say on this one. This is just a barefoot yoga session with an emphasis on the feet. So take that link, check it out, and enjoy. Use it as a resource, whether it's now or later. But that one is a great combination of strengthening, mobility, and flexibility. Just to talk about shoes a little bit, and I've sat in on multiple presentations on shoes. And if there's interest from you all to dive in deeper to that, or if you want links to those presentations, let me know. But what's going on with our shoes is very, very important. We're taking however many steps a day, and okay, so if 10,000 steps a day is like a average active person's day, that means there's 10,000 times that you could be moving a little bit better or a little bit worse, depending on your shoes. So in my mind, that's pretty important. And then thinking about all of the domino effect that happens from the ground up, not only during sport, but just in everyday life, very, very important. So as far as what your arches are doing, if you've got flat feet, I do think that you're probably going to want some arch support. If you've got really high arches, you probably don't need as much support unless you're starting to feel that collapsing arch. So from what I understand, if you're a high arch person and you're starting to lose that high arch that you've had for maybe the last 20 years or so, it may be painful. It may feel like plantar fasciitis. It may be throwing off some of your mechanics. I don't think we necessarily need that super high arch. However, if it's causing pain and discomfort, from what I understand, it's advisable to throw some support under there, even if you are already maintaining a pretty high arch. So think about your comfort there. So I put the Coliseum in there because we want to talk about that arch support and where you're at as far as maybe fitting into some of the theories that we've talked about already today. And then just rule of thumb, I thought I'd throw that in there. Just there's always little tips for how to buy your shoes. And one of them that I came across was that you want to be able to push like the edge of your thumb between your big toe and the end of your shoe. And that's held pretty good. So not necessarily wanting to wear shoes that are crammed in too tight for everyday wear. And again, I went ice skating for the first time last night. And I'm normally a 12-inch shoes, and the other more seasoned hockey players were suggesting that I wear like a 10.5-inch skates. So if you're going ice skating anytime soon, that's something to keep in mind. Let's see, other shoe tips. I would just encourage you all to, you know what, here's one. If you're taking up running and doing a lot of work like that, have shoes that you rotate through, because if you run on a shoe and then give it time to decompress, it will last longer. If you spend the next day running in a different pair of shoes, because the shoes, they almost like heal a little bit because they'll decompress and they'll dry out and all that good stuff. Because I got sweaty feet, so when I put in work in shoes, I mean, it gets juicy in there. I'm compressing them down. So when I rotate through shoes, I have benefits there. My shoes will last longer than they would on their own. I'll kind of leave that alone on shoes. There's a lot of material that you can cover there. Just to throw in a couple of like oddball kind of woo-woo things here. Grounding would just be the act of getting barefoot on the earth's surface. And there's supposed to be some great health benefits from it. I don't know how much I buy into some of these different factors, but I will say I do like being barefoot out in the grass. So whether that's the exchange of negative ions with the earth and helping my energy, my electrical energy in my body. I don't know if it's doing that or not. Is it the essential oils that come from being out in nature, and just like the oils that the plants are producing? I don't know if it's that or not. Is it the sunlight, like extra sunlight on your body, extra skin exposure to just the UV radiation? Maybe it is that. Is it the grass between your toes and just unique textures on your feet walking through grass and dirt? Maybe it is that, I don't know. And then if you look over to this next chart, with our body, our nerves sort of end at the feet. So it's logical that if we are intervening at the foot, we have a chance to interact with just different areas of our body, especially in like a nervous system facet. So here's a little bit more of a typical scientific chart. And I've seen several of these over the years, where they feel that the foot has different benefits for different zones. So let's see here. I've heard a story once about a guy giving his pregnant wife, a foot massage because she's in really terrible pain. And then she ended up just kind of having like gas. So kind of funny, but there's nerves that go down there. How accurate is this chart versus another kind of woo-woo chart that I've seen in the past? I don't know. I don't necessarily subscribe to all that. I'd say, as opposed to all of this stuff over here, I'm probably about as wacky as I go on it. I think grounding is good and has some benefits. The weather's pretty awesome today, and I need to rake my yard, so I'm thinking about maybe raking barefoot for a little while and maybe get some sunlight on my pale toes that you guys just had to look at. And here's just some additional resources. Pretty much all foot based. Dr. Emily Splitchell is a podiatrist, and she has certifications and a lot of teaching on how to deal with like arthritis, plantar fasciitis. I mean, she does a little bit of everything. So she's a resource that I've looked to in the past, and that I plan on doing a lot more learning from her. Go to Natural Movement. This seems to be a newer organization that I've only been familiar with for maybe just a couple of months. But what they're doing is if you think about the GOAT, the greatest of all time, they're taking a movement pattern seen in the greatest athletes on the planet, and they're working on getting the masses to move a little bit more like that. I really like that logic. However, I'm not. I need to learn more about them. I'm not convinced that all people are going to move like Michael Jordan, but I like their logic, and I need to do more research into that. Graham Tuttle is kind of known as the barefoot sprinter, and so he's going to have a lot of good things for us on strengthening the feet and moving properly. And then Dr. Kelly Starrett, you guys have heard me sing his praises many times. So here's some additional resources for us. And that is all I've got for you today. All right, everybody have an awesome day. Take care of your feet.